Hello there, you're watching the press preview, our first look at what's on the front pages as they arrive. Over the next half an hour, we're going to be talking through the headlines with the Daily Express columnist Carole Malone and Liam Thorp, political editor of the Liverpool Echo. So very good evening to both of you. Nice to see you both.
Hello, lovely to see you.
Thank you very much. Let's take a look then at what's making the front pages. And the Metro leads with a warning from a government scientific advisor that lockdown should not be eased too soon and there's no quick fix for COVID. On the front of the Daily Telegraph, pandemic risks repeat of 1930s chaos, says Forces chief. Millions in NHS limbo, the Eye reporting that nearly 250,000 people have been waiting over a year for routine hospital procedures. The Times warns that although lockdown could be eased, social distancing rules could remain. Guilty, writes the Yorkshire Post, as a man is convicted of the rape and murder of 21-year-old student Libby Squire. The Mirror leads with tributes to Libby Squire too from her family. Road plans in doubt on the front of The Guardian, the paper reporting that the Transport Secretary overrode official advice, they say. And the Financial Times leads with details of the plan by the billionaire brothers Mohsin and Zubair Issa to buy supermarket giant Asda. So Carole Malone and Liam Thorp here with me to go through some of those headlines. And Carole, you want to kick off with the Metro, and the headline there is there's no quick fix. This is a warning from a sage advisor to the government, isn't it?
Yeah, it's Jeremy Farrar, who's a senior government advisor. What he's basically saying is that, Boris was going to make his lockdown exit strategy public on February the 22nd. And Jeremy Farrar is basically saying, don't do that. It doesn't make any sense. But, Boris has got to stop being led by scientists. It is not a scientist's job to dictate government policy. Boris has got to listen to the science, yes, but, COVID deaths are down by a third currently. The case rate is down by 70%. We're currently doing 1,000 injections every minute or something? Yes, 1,000 vaccinations a minute. And death rates are tumbling, infection rates are tumbling. What do these scientists want? Do they want a world where there is zero COVID? Because we know that is never going to happen. They're saying there's no quick fix, but we have to get out of lockdown. Scientists have already said that this COVID is going to be endemic, but every time there's talk of easing restrictions, they keep on bringing up another variant, the Kent variant, the Bristol variant. It'll be the Scunthorpe variant next. Viruses always mutate. So far, there have been 4,000 variants identified, COVID variants. Unless they're going to kill us, unless they don't work against our current vaccines, don't keep telling the population and terrorizing us, because it is not an option to stay in lockdown permanently. And I think this is just yet another way for the scientists to keep us in lockdown. Boris has to start leading soon. He's our leader. He's got to decide when we come out of lockdown, not the scientists.
You're shaking your head, Liam. What do you make of that?
Carole won't be surprised to hear me disagree with absolutely everything that she just said there. I don't really understand this argument about why the scientists would want to keep us in lockdown. I often get accused of wanting people to stay in lockdown because I think it's the right thing at this exact moment. Nobody wants to be in lockdown. It's a terrible thing for everyone. I think what I'm really concerned about is the same mistakes being repeated again. Carole says that we shouldn't be led by the scientists. Well, actually, the government has not listened to the scientists too many times before. In September, Sage said that we needed to go into a lockdown at that exact moment. Boris Johnson delayed, and we ended up in a bad situation again. If we come out too early, we will just end up in lockdown again. We desperately need this to be the last lockdown.
We have a vaccination, Liam. What is the point of the vaccine rollout if we're going to stay in perpetual lockdown? Once we have vaccinated all the vulnerable people, what's the problem?
We're not going to stay in perpetual lockdown, but we need to get as many people vaccinated as possible and bring the rates right down, because unfortunately, the NHS will just come back under severe pressure again.
The pressure is easing on the NHS.
From personal experience, it is easing. But if we came out now, for example, in Liverpool, the infection rate is still 260 cases per 100,000 people. If we came out now, that would explode again. It's already much higher than when Leicester went into lockdown in the summer, for example. So the case rates are still very, very, very high. Yes, we're starting to see them come down, although they've plateaued a little bit recently.
Tumbling. They're not coming down, they're tumbling. And Boris was going to make his announcement on February the 22nd. Things are changing very quickly now. And he shouldn't be put off from making announcements on the 22nd because the situation is changing daily. It's getting better daily.
What happened with Christmas? He overpromised in late November, told everybody that we're going to have a 5-day free-for-all at Christmas. And look, I think even you, Carole, would have to admit that it was an absolute disaster. And we saw an explosion in cases in January. And we've now had, in parts of the country, we've had the deadliest month of the pandemic. We want to avoid ever having to go through that again. And if that means having to stay in this process a little longer.
Sorry, I didn't mean to cut you off, Liam, but I was just going to move us on to the next story because it is connected. And Carole, this is in the Daily Telegraph. They're saying a school return date must be signed in blood and inverted commas. And presumably this is pressure from Boris Johnson's backbenchers, worried that that date of March the 8th that's been mooted might slip.
Yes, and this is the point here, because, and with what Farah has said tonight, and probably the other sage people will back him up on what he has said tonight, what MPs are worried about is this is going to put off Boris reopening the schools on March the 8th. And they're trying to persuade Boris not to make any announcement on the 22nd. I think it could be the 22nd or any time that week. And they're trying to persuade him not to do that. Which means that date for the opening of schools may slip. You know, we can't keep schools closed. Now, Boris is going to have a lot of trouble anyway getting the schools reopened. Because of the union opposition, they're making incredible demands before teachers go back to school full time. I mean, some of them are unreasonable demands. I mean, especially when we see a lot of public service workers have been at work throughout lockdown and have not complained the way the teaching unions have. But, you know, we have got to get our children back to school. We can't keep putting off. It's been nearly a year now, and a year out of education is massive in a child's life.
Well, yes, and the government has all along, Liam, talked about it being a priority to get kids into school if at all possible, but there does seem to be a lot of caution this time round. There does seem to be a lot of concern about infection rates.
I'm actually pleased that for the first time in this whole crisis, I think that the Prime Minister is adopting a more cautious approach. I completely understand and I completely agree that the absolute priority is to get kids back into school as soon as possible, because certainly for many in deprived areas, online learning is just not a possibility. We're going to see that attainment gap grow in ways that we really don't need to. However, as I've said before, if we move too quickly, then we end up in another lockdown. And, you know, that's the last thing any of us need. That's the last thing our kids need. That's the last thing anybody needs. So I am actually pleased to see a little bit more caution from the Prime Minister than we have seen in previous times. I think it's now widely assumed that we were too late into the first lockdown, too late into the second, too late into the third, and we're now paying for that.
All of those lockdowns, we didn't have the vaccine. Now we have the vaccine. Why are we being super cautious when we've already vaccinated most of our vulnerable people? In the next few weeks, we're going to have vaccinated everyone to 50. After that, we should not.
Quick comeback on that, Liam.
There's still a lot of questions about the current impact of the vaccine. You heard Patrick Vallon say it the other day. We need to see what its effects are on transmissibility. We need to see what its effects are on death rate. Obviously, things are looking good in that department. But if we move too quickly, we don't know what's going to happen. We do not want to end up in this situation again. So a little bit more caution now is what's needed. And then hopefully we're all in a better position in a few months' time. OK, and let's move on to the eye. Millions in NHS limbo. Figures out today talking about the number of people on waiting lists for routine procedures. They say it's the highest number since record began in 2007, Carole. Huge pressure on the NHS because the number of people in hospital at the moment with COVID.
Yeah, you know, the numbers of people waiting for more than a year for what was supposed to be urgent treatment has rocketed in December. We've got the figures for December to 224,205. Now, compare those figures to 2019, and there was 467 people waiting. I can't even work out the percentage of what that is now. You know, we keep on talking about COVID deaths, and yes, every one of them is tragic. But, we haven't begun to think about the people who are going to die because of cancers, undetected cancers, or cancers that have been detected which just aren't going to be treated, heart disease, all sorts of other illnesses.
Okay.
The death toll will be more than the COVID death toll.
Okay, and I want to let Liam quickly make a comment on this before we go to the break. Liam?
Yeah, I mean, it's a disaster when you think about it in terms of the number of people who are waiting for urgent care. I do think sometimes the argument is framed wrong, though. I think it's seen as these conditions against the lockdown. It's not. Our NHS has been on the brink of being overwhelmed by a killer virus that we never knew about before. It's not a case of making those choices. The NHS is obviously doing what it can to try and balance these things out, and it's a terrible situation. But it's not lockdown that's stopping these treatments. It's COVID-19.
OK, we are going to take a pause right there. Plenty more to get our teeth into in just a moment, including motorway death reignites the debate over smart motorways. We're going to be discussing that in a moment.
Doctors are taught to not give of themselves, because if we give of ourselves always, there will be nothing left for us. And so we do have a wall, but patients really appreciate the human, and they really want to see that sometimes. And so it's about striking the balance between giving enough that patients feel listened to and feel that you understand them, while still protecting yourself. And actually, I think that that's something that we need to be teaching medical students much more, because the difficulties with the wall versus the human are essentially one of the reasons why we think so many doctors have mental health problems, because it is such a difficult balance. But patients really do seem to appreciate the fact that I truly understand. Now, of course, it's still about them. It's not about me. But just knowing that somebody gets it can make a real difference.
I'm Adam Parsons. I'm Sky's Europe correspondent based here in Brussels. More flares going off, a volley of rocks, cobbles have been pulled up out and are being used as missiles to hurl at these police. We take you to the heart of stories that shape our world. We aim to be the best and most trusted place for news. We have now left Italy and entered France. Nobody's asked to check our identity. Made by people who dare to challenge. Nice to see you again, Mr. Barnier. Why?
Meeting you.
Fishing does have the potential to stymie an enormous economic deal. What strikes you when you come to this glacier is not just the way in which the environment is changing, but the speed at which those changes are happening.
It's devastating, actually.
For the early risers.
As we examine the story beyond the headline.
For the knowledge seekers.
Welcome to Divided States.
For the straight talkers. The curious and the ones who want to be entertained.
Backstage, Sky News' entertainment podcast.
For wherever you are.
Welcome to Sophie Ridge on Sunday podcast.
For the ones who want to know more.
Welcome to the All Out Politics podcast.
For the listeners.
From Sky News Storycast.
Sky News Podcasts. Listen and subscribe for free.
Welcome back. You're watching the press preview. With me tonight, Daily Express columnist Carole Malone and Liam Thorp, political editor of the Liverpool Echo. Welcome back to both of you. Carole, you've picked out a story on the front of the Yorkshire Post next, and this is over a death on a smart motorway. So what's the Yorkshire Post telling us?
This is a really tragic story, and it's not the first time there has been a catastrophe with these smart motorways. But this was a lady, a 62-year-old lady called Nargis Begum, and her car broke down on a stretch of the M1 on a live lane, and she broke down where the hard shoulder would have been before they took it away. And she was standing there, she called for help, and she was standing there for more than 15 minutes before Highways England put the warning signs on. But she was tragically hit. You know, she was hit and killed. Now, this is just appalling. And now the story is that Highways England could face charges, criminal charges, maybe even charges for manslaughter because of this lady's death. And, you know, it's something like this needs to happen for the Highways Agency, for this government to look at what they have done on our motorways. Cars are always going to break down. They have to have somewhere to go, to be pushed to while they're waiting for help. The signs overhead that are supposed to warn people about this, they work probably 90-odd% of the time, but they don't work all of the time. And because they weren't working on this particular day, this lady is now dead, and her family have to face a lifetime of their day. You know, whoever invented these motorways, whoever thought about them, and even when they were first mooted, there were so many objections to them. People said that they wouldn't work and that this would happen, and they were ignored. And now look, you know, there's going to have to be some kind of change here where they change it back and give us a lane where people can go to be safe.
OK, yes, and it's certainly a debate that we're hearing a lot at the moment. It'd be interesting to see if there are developments on that. And we're turning to the front page of the Daily Mirror next, aren't we, Liam? And this, a very sad front page. Our wonderful girl will always be with us. This is Libby Squire and her murderer found guilty today.
Yeah, and it's, you know, absolutely right to see the Mirror going very big on this. It's such an utterly tragic story, and I'm pleased to see the Mirror come at this from the angle of the mum of Libby Squire. It's just absolutely every parent's nightmare. You know, your child goes off to university to have the time of their lives, and to hear like something like this happen. And some of the details that have come out in the case are horrific in terms of some of the other crimes that Relevich has been involved in, voyeurism and sexual crimes. And there are perhaps some questions for police to answer. There's been some suggestion that perhaps there was a pattern of behaviour there. However, you know, sometimes hindsight is a good thing when you're looking at the case and the details as a whole. All we can say is that Libby sounds like an absolutely wonderful young woman, been described as wickedly funny, an amazing young woman, and she's been taken from her family. And I think it was the longest running investigation that Humberside police have carried out. And so at least it's something that we've been able to get a conviction today. But as Libby's mum said today, it doesn't do anything to bring her daughter back. So it's just an utterly tragic case, and one that I think will stay in people's minds for a long time. Indeed.
Desperately sad. Humberside police say, though, that there's nothing more that they could have done, given the information that they had at the time, they say. We are going to leave it there. I'm pleased to say you'll both be back at 11:30. Lots more to talk about then. But for the moment, Carole and Liam, thank you.